It was July 30th, and we were headed to the concert. It was Garth Brooks. Tiffany mentioned she started feeling dizzy. And so we thought it was just being in a hot car in the middle of the summer. So moved her to the middle seat, rolled down the window to let her get some air, gave her some water. As we're being dropped off, she kind of looks me square in the eyes and says, "I'm not going to go. I'm feeling really bad. Something seems off." It was clear that she was having a stroke. Her mouth was drooping. She wasn't able to make eye contact. She started to slump in her chair. So jumped back in the car, told the driver to take us to Texas Health Arlington Memorial.
She got the standard CT of the head first. This non-contrast means we don't give any dye, look for any bleeds. Okay, that's a very important first step. They exclude a bleed, and when they exclude any blood, they realize, okay, there's a stroke happening potentially because of a blocked vessel. I was alerted on my cell phone through an application that detected that she had been at Texas Health Arlington Memorial having a stroke. So they gave her something called a thrombolytic. And when they give a thrombolytic, that targets the clot to lyse that clot hopefully very quickly. That's the fastest way you can get to a clot, is give a medication, have it open it up.
And immediately her symptoms of stroke faded. Her voice came back. Her eyes became focused again. So it seemed like we had the all clear. Little did I know this was going to be a years-long journey. And it got a lot more rough after that.
She got way worse, where she wasn't moving anything anymore, went unconscious. She had to go undergo resuscitation then for many, many minutes. At that point, once they stabilized her, they transferred to our hospital, Texas Health Fort Worth.
Was immediately seen by Dr. Fiesta in the emergency room. They found that the artery had already self-healed, but the damage had been done.
The vertebral artery had an injury to it. It was called a dissection. And that injured vessel had likely gotten so narrow that it formed clot and it flecked up to her brain.
It was, I think, 5 days in the ICU. But Tiffany started her fight maybe 3 days after the stroke and has fought on ever since.
My mind started clearing up as to what was going on. So, some of the nurses, they made me aware that I had had a stroke.
I didn't think strokes happen to people under the age of 50.
Yeah.
So it was a shock, but it was at least one that we were able to recognize early.
Here at Texas Health Fort Worth, we have the highest volume of stroke admissions than anywhere else in North Texas. Part of that is because we have the highest standard of care, which is the Joint Commission Comprehensive Stroke Certification.
The Lord was with us because we got to the hospital. All these things happened. But I don't think that any of it really would have been possible. My recovery journey would not be what it is now without Texas Health.